What to know about overactive bladder? The overactive bladder is a set of symptoms that affect the behavior of this organ. As a consequence, those who suffer from this problem may feel the negative impact on their quality of life. Overactive bladder syndrome does not choose gender or age, although it is more common in women over 60 years old. Be aware of the main symptoms. What is it? The overactive bladder is not, from the clinical point of view, considered a disease. It is rather a set of symptoms, of which the sudden urge to urinate stands out, and the involuntary loss of urine, also known as urinary incontinence. The overactive bladder consists of an involuntary and sudden contraction or tightening of the muscle of the bladder wall, even though the volume urine is reduced. And why does it happen? In a healthy urinary system, the kidneys produce urine by draining it into the bladder. And when it is full, nervous signals are sent to the brain, indicating an urge to urinate. The bladder muscles contract, pushing urine out. The urine passes through the bladder, through an opening in the lower part, reaching the outside through a channel, the urethra. But when it comes to the overactive bladder, the muscles of this bladder organ send wrong messages to the brain, causing the bladder to contract more than it should, even with a reduced amount of urine. The causes for overactive bladder are still unknown. Even so, it is known that the conditions can contribute to some symptoms of this problem. It is the case of stroke, multiple sclerosis, diabetes, medicines that increase urine production, tumors or stone infections in the urinary system, excessive consumption of caffeine or alcohol, decline in cognitive function due to aging, and incomplete emptying of the bladder. And the main symptoms are: urinate frequently. Incontinence is an involuntary loss of urine. Nicturia, which is waking up 2 or more times during the night to urinate. How to prevent overactive bladder syndrome? In general, it can be controlled with some lifestyle changes, such as maintain a healthy weight, exercise regularly, avoid consumption of teas, coffee, alcoholic drinks, soft drinks, and citrus-based drinks, tomatoes, spicy foods, chocolates, and artificial sweeteners. Don't smoke. Control chronic diseases, like diabetes. Do Kegel exercises, which consists of contracting the pelvic floor muscles, right? And endure the contraction for 5 seconds. Those who can't stand it can try it with 2 seconds. Then relax the muscles for 10 seconds. Then repeat the contraction for 5 or 2 seconds. Relax for 10 more. And do 3 sets of 10 repetitions per day. That's it, a brief summary. Hope you like it. Leave your like. Share on your social networks. Subscribe to the channel. And until the next video,